Hello, everyone. My name is Leah Lande. I'm a pulmonary and critical care physician here at Lankenau Medical Center. I'd like to welcome all of you to Lankenau for the NTM Patient Physician Conference. In particular, I'd like to welcome our wonderful patients, who are truly our partners in this mission. I'd like to welcome the physicians and scientists who have dedicated their careers, many with an intense passion, to furthering our understanding of this disease and to caring for those afflicted by it. And I would like to welcome Philip and Fern Lightman, who are sitting up here in the front, the founders of the NTM Info and Research Organization. Sorry, that makes them uncomfortable, but they deserve it. I'd like to thank them for creating this forum in which we can come together to share our ideas and concerns in a collaborative fashion. The theme of today's conference is Progress Comes from United Efforts, and I would like to take a moment to reflect on this concept. In the room here today, we have clinicians in pulmonary medicine, infectious disease, primary care, and we have scientists who do both clinical and basic research, and we have patients and their family members. And we also have a representative from a local water company. By bringing together individuals who can understand this problem from these multiple different perspectives, we are sure to advance our understanding of this disease and better define future directions that are needed in research and patient care. From a personal perspective, I'd like to share with you how a recent collaboration has influenced us here at Lankenau. We'll show you today how we've had an increasing incidence of NTM infection in our local community. A few years ago, we invited Joe Falkenham here to give a talk. And afterwards, we discussed embarking on a collaborative study, which I will tell you about a little later. Richard Wallace then joined us in our work here, and he had talents and perspectives on this that were complementary to each of ours. We now have a team composed of pulmonologists from Pennsylvania, a microbiologist from Virginia, and an infectious disease physician scientist from Texas. Each of us brings a different perspective to our work, and the exchange of ideas and the teamwork has been tremendous. As a clinician who is faced every day with individual patients, as well as with a community of patients with this disease, the mentorship and education which I have derived from these relationships has been invaluable. So it's clear that when it comes to NTM infection, the status quo is unacceptable. What can we improve upon? Prevention, earlier diagnosis, more effective and less burdensome therapies, education of the public about this disease, education of water and environmental agencies about this disease, and education of physicians about this disease. Hopefully, our discussions today will be a starting point for further progress in these and other areas. I'm now going to hand over the microphone to Philip Lightman, president of the NTMIR organization, who will introduce today's speakers and have some opening remarks.